Hello, Professor. I did my presentation on Alzheimer's disease, and I'm going to begin my presentation. So, Alzheimer's disease is a degenerative disease that affects neurons. It's caused by its accumulation of the amyloid plaques in the brain. The plaques cause the neurons to tangle. As a result, it causes memory loss and complications as the disease starts to progress. There's different onsets with the disease. First one being the early onset. The patient presents with difficulty recalling past dates, times, events, conversations, and speech, may frequently misplace belongings and repeat questions, but they are still able to complete activities of daily living like eating, bathing, walking, and talking. For the late onset, incontinence can be observed with these patients. Patients also suffer from personality changes and the inability to communicate properly. These patients are frequently at risk for becoming dehydrated and may fall frequently. In a normal functioning central nervous system, the neurons are able to maintain their connections and the neurons are able to communicate appropriately. The negative feedback loop for this system maintains to be intact. The patient is able to walk, talk, and have the ability to do higher thinking because the negative feedback is effective. The negative feedback in a normally functioning brain, the sensor neurons send a stimulus information to the control sensor, which is the brain. The brain sends a command to the body part to react. The body is then able to walk or talk or eat based off of this negative feedback. In a patient that has Alzheimer's disease, the negative feedback is affected. The neurons are unable to process the information because of the plaques, and the brain is unable to send a command to the body. The patient then suffers from memory loss and other complications as a result. For diagnosis, either a patient or the family member recognizes the changes in their cognitive ability and they seek help. When they go to the doctor's office, the doctor will first run labs and a series of physical exams to rule out any other diseases. Next, the doctor will complete a cognitive exam and a PET scanning of the brain and use the findings to diagnose the patient with Alzheimer's disease. So they don't automatically diagnose patients with Alzheimer's disease. They try to go through all types of physical and mental exams before they give the final diagnosis of the patient. A similar disease is dementia. Dementia is similar to Alzheimer's disease, but it's not the same. Dementia is characterized by impairment of ADLs due to several underlying issues. So Alzheimer's disease can lead to dementia, but it is not the same as dementia. There are currently no cures for Alzheimer's disease. There's only tests that can help confirm it. There are, however, medications that can help with cognitive enhancing. Patients in late onset will need a caregiver, and that can work as a form of treatment for someone to kind of look over them and help bathe and feed them and just kind of make sure that they're on the safe side since these patients are disorientated. Barriers that will stop a patient from seeking treatment would be the fact that the disorder doesn't have any cures. It may stop a patient from wanting to seek out treatment. The tests are also expensive and invasive, and this may cause a person to not want to seek treatment. And that is the conclusion of my PowerPoint. I hope you enjoyed. Thank you. Bye-bye.